Hello learners, in this video we are going to see some MCQs from anatomy, especially from upper limb. Let's get started. The first question is, the trapezius attaches to which of the following regions of the clavicle? Options are lateral 1/3 of clavicle, conoid tubercle, subclavian groove, trapezoid line, quadrangular tubercle. In this question, answer is lateral 1/3 of the clavicle. We'll see the description. As you can see in this image, trapezius is attached with lateral third of clavicle, acromion and spine of scapula. But the trapezoid ligament attaches to the trapezoid line. So the answer is A. Next question. Which of the following is not included in the condyle of humerus? You can see the options here. Actually, condyle of the humerus, which means the distal end of humerus, includes both epicondyles, trochlea, capitulum and 3 fossae. So, here we don't have greater tubercle. So, we should eliminate greater tubercle so that we can get the parts of condyle of the humerus. So option E is answer. Next question. Which of the following is not a branch of radial nerve? Actually, the branches which have been mentioned here all are the branches of radial nerve except option D, which is superior lateral cutaneous nerve of the arm, because superior lateral cutaneous nerve of the arm is a branch of axillary nerve. So the answer is D, superior lateral cutaneous nerve of arm. But posterior cutaneous nerve of arm, forearm, posterior interosseous nerve are the branches of radial nerve only. Next question. Which of the following is not an anterior thoracoappendicular muscle? Options are pectoralis major, minor, deltoid, subclavius and serratus anterior. And the answer is deltoid. Why? Because deltoid is a scapulohumeral muscle, which means shoulder muscle, but pectoralis major, pectoralis minor, subclavius and serratus anterior or anterior thoracoappendicular muscles. So the answer is deltoid. Which of the following muscles attaches to the coracoid process of the scapula? Options are pectoralis minor, triceps brachii, brachialis, pectoralis major and subclavius. As you can see in this picture, pectoralis minor, short head of biceps brachii and coracobrachialis attaches to the coracoid process of scapula. Pectoralis minor, short head of biceps brachii and coracobrachialis. And the given option is pectoralis minor. So option A is answer. Next question. All of the following are medial rotators of the arm except. Options are latissimus dorsi, teres major, subscapularis, infraspinatus, anterior part of deltoid. And the answer is infraspinatus, option D, because infraspinatus and teres minor rotate the arm laterally. Instead of that, latissimus dorsi, teres major and subscapularis medially rotates the arm. Coming to the deltoid, it is unique muscle. Its anterior part rotates medially, posterior parts rotates laterally. So the answer is infraspinatus. Next one, which of the following is an extrinsic shoulder muscle? Options are deltoid, teres major, levator scapulae, teres minor and supraspinatus. I hope it will be clear in this image. Trapezius, latissimus dorsi, levator scapulae and rhomboids are extrinsic shoulder muscle, but deltoid, teres major, supraspinatus, infraspinatus, teres minor, subscapularis, they are the intrinsic shoulder muscles. In this question, it has been asked for extrinsic shoulder muscle. So the answer is option C, levator scapulae. Next question, which rotator cuff muscle does not rotate the humerus? Supraspinatus, infraspinatus, teres minor, subscapularis or teres major. Actually, except supraspinatus, other muscles rotates the humerus, but supraspinatus is the only rotator cuff muscle that does not rotate the humerus. So the answer is supraspinatus. Next, cubital fossa does not contain which of the following? So to answer this question, we should know the contents of cubital fossa. So coming to the contents of cubital fossa, from medial to lateral we have a mnemonic that MBBR. So M is median nerve, B is brachial artery, another B is biceps brachii and R is for radial nerve. Coming to the options, terminal part of brachial artery, deep accompanying veins, median nerve, biceps brachii tendon and ulnar nerve. And the answer is ulnar nerve. And the deep and superficial branches of the radial nerve are within the floor of the fossa. So they are also within the fossa. Next, a patient is unable to flex the arm and forearm. Where is the lesion likely to be? So, to answer this question, we should know which muscle is likely to get affected. In this case, patient is unable to flex the arm and forearm. So, probably lesion is at the level of C5, C6, C7. So, the muscle which could be affected in this case, biceps brachii, brachialis and coracobrachialis. Coming to the nerve supply, biceps brachii and brachialis receives C5 and C6, but coracobrachialis receives fibers from C5, C6 and C7. So in this case, C6 is the main source of fibers for each. So the answer is C5, C6 and C7. Biceps brachii, brachialis and coracobrachialis are the muscles likely to get affected. Which muscle does not cross the elbow joint? Options are flexor pollicis longus, pronator teres, flexor carpi radialis, flexor carpi ulnaris, flexor digitorum superficialis. Actually, superficial muscles crosses the elbow joint, but deep muscle do not cross the elbow joint. In this case, flexor pollicis longus is a deep muscle, so that doesn't cross the elbow. So the answer is flexor pollicis longus. Next question. Radial artery lies just lateral to the tendon of which muscle? Before going to the options, we'll see this image. As you can see in this image, the most lateral part is radial artery, and we have a tendon of flexor carpi radialis which is there nearby. So the answer is flexor carpi radialis. So radial artery lies just lateral to the tendon of flexor carpi radialis. Next question. Which of the following does not abduct the hand at the wrist joint? Options are flexor carpi radialis, extensor carpi radialis longus, extensor carpi radialis brevis, abductor pollicis longus, palmaris longus. And the answer is palmaris longus, because other muscles helps in abduction of wrist joint. And the last question. Which of the following is derived from the radial artery? Options are dorsal and palmar carpal arteries, common interosseous artery, anterior interosseous artery, posterior interosseous artery, ulnar recurrent artery. Answer will be cleared by seeing by this image. Radial artery gives rise to radial recurrent artery as well as dorsal and palmar carpal branches. But the ulnar artery gives rise to the common interosseous artery, anterior and posterior interosseous arteries, anterior and posterior ulnar recurrent arteries, dorsal and palmar carpal branches. So in this case, radial artery gives rise to radial recurrent artery as well as dorsal and palmar carpal branches. So the answer is option A. This is all about today's session. Thank you so much for watching.